Hello, my name is Madeline Clune, and this is my final return demonstration. Hi, I'm Maddie. I'll be your student nurse today. I'm going to do a full physical examination on you. Can I ask for your name and your birth date?
Ava Clune, December 13th, 2010.
Yes, good job. Nice to meet you, Ava. Prior to this, I did wash my hands, so that's all clear. As I stated earlier, my name is Maddie. I'm going to have to ask you to remember that name for later in the assessment to assess your long-term memory. How are you doing today? Any pain, problems, or complaints?
No.
No? Okay, good. Are you able to tell me how old you are and what your race is?
I'm 10 and I'm a girl.
Okay, are you able to tell me how old you are and what your race is?
I am 10 and I am white.
Good. Do you feel that you are overall in good health with no issues?
Yes.
Okay, I would say that you're a vigorous, healthy 10-year-old female. Okay, are you able to tell me your height and weight?
I'm 4'10" and I weigh 102 pounds.
Okay, and previously, as we were speaking before this video, we calculated her BMI and it's at 21.3, which is within the normal range. So that's good. I would say your dress, grooming, and hygiene are good. Your demeanor, cooperative, and your affect is animated. Your thought pattern seems to be logical, relevant, and organized, and your speech is articulate, and you seem to be very alert. Could you state your full name for me, please?
Ava Mary Evelyn Clune.
Good. Could you tell me where we are right now?
Manassas, Virginia.
Good job. Can you tell me what day of the week it is?
Monday.
Mm-hmm. Now, can you tell me who the president was before Biden?
Trump.
Good job. Great. Are you able to tell me my name again?
Madeline.
Yes. Okay, Ava, if I were to say to you, an apple a day keeps the doctor away, how would you interpret that?
Eating fruit keeps you strong and healthy.
Good job. If I were to say it was raining outside, what would you do to prepare to go outside?
A raincoat, maybe an umbrella, and rain boots.
Good job. The patient is oriented to person, place, and time. She is alert, and all intellectual capacity parameters are intact. Is it okay if I take your vital signs now?
Yes.
Okay. Why don't we go ahead and start with your temperature. Go ahead and put that under your tongue. Get with it. Get with it. Okay, perfect. 97.9. Totally normal, totally healthy. Okay, I'm going to ask you to lean forward and put your arm on here. I'm going to take your blood pressure. You come closer and film this. good. It was 110/68, which is within normal range. As long as it's under 120 and 80, all is good. Okay. Now I'm gonna go ahead and check your pulse. Okay, good. Your pulse was at an 82, and your respirations were at a 14, which you were just running around before this, so I'm not surprised. All right. Right. You stated earlier that you were not experiencing any pain. Is that still the case?
Yes.
Okay, good. All vital signs were within normal limits for your age and your weight and your height, which is good. My head is symmetrical, good shape. Hair seems to be evenly distributed. I'm going to go ahead and tug on some of your hair. Okay, hair is intact. I'm going to feel for any lumps or lesions on your skull. Okay, negative for any lumps or lesions. Okay. The eyes are properly aligned and they have the appropriate prominences to them, which is good. Now I'm going to be assessing your perla, and I'm going to be shining my light into your eye. So just a warning. I'm going to do it 2 times on both sides, okay? Ready? Good. Perfect. Okay, I have the appropriate pupillary reactivity from both eyes. Now I'm going to have you look over at that doorknob, and when I say, you're going to look back at my pen light and focus, okay? Right, ready? Go ahead. Good. Okay, there's good bilateral pupillary constriction and ocular convergence. The combination is good. Okay, now I'm going to have you look at the end of my pen light, and I'm just going to check your extraocular eye movements, make sure there are none. You're going to go ahead and follow it. Don't move your head, just your eyes. Good. Negative for any extraocular eye movements. Okay, in your ears, look symmetrical. And we look negative for any lumps, lesions, or scarring. Yeah, no lesions, deformities, or scarring, no bumps or lumps in your ears. I'd say your gross hearing is grossly intact from what I've seen and from our previous conversations. You haven't asked me to repeat things or stated that you cannot hear me at any point. Okay, now I'm just going to go ahead and examine the internal and external auditory canal of your ear. All right, there's no redness or swelling. Negative for any drainage, visible drainage at least. Okay, now I'm going to go ahead and pull your ear up, out, and back so I can get up, back. We get a good view of the inside. Okay. Up, out, and back. Okay, hold on. Okay. There's no redness inside the ear. There is some soft wax, which is normal, and the ear canal is clear and intact. Okay. Nose. Do you have any congestion during the summertime?
No.
No. Okay. Negative for congestion. Go. All right. I'm going to go ahead and see if there's any septal deviation. All right. Negative for septal deviation. The mucous membranes are pink, moist, and intact. I see no drainage or blood present. Do you have any difficult breathing in through your nostrils?
No.
Okay. Could you take a deep breath in through your nose for me? Good. No nasal flaring when you were breathing, and you did not appear to have any difficulty. Are you able to smell odors and fragrances just
Yes.
fine? Okay. All right, I would say your smell is grossly intact. Throat, can you open up wide for me? Stick your tongue out. Good. Now, can you lift up your tongue? Good. The throat is pink, moist, and intact. I did not see any lesions. There are no missing or loose teeth, dentures, no dentures. I did not detect any odor. All right, can you swallow for me, please? Good. Choose a positive swallow. All right, I'm going to go ahead and palpate your trachea. Make sure it's all in line. Okay. Good. The trachea is vertical with no enlarged thyroid gland. Excuse me. Is there any? Okay, now I'm going to go ahead and palpate your lymph nodes. All right, so preauricular. Does that hurt?
No.
Okay, now I'm going to go ahead and assess your lymph nodes.
Okay.
So preauricular, postauricular, occipital, tonsillar, submandibular, submental, posterior cervical, deep cervical, supraclavicular. Okay. The lymph nodes are completely non-palpable, which is good. All right, now I'm going to go ahead and feel your carotid artery. Good, strong 3+. Good, strong 3+ as well. Now I'm going to go ahead, I'm going to ask you to take a deep breath, let it out, and then hold it so I can listen to them really quick, okay? Go ahead for me. Okay. Okay, good. Negative for any bruise, which is good. Okay. Skin is appropriate, flesh tone is appropriate, moisture appropriate, temperature good. Negative for any lesions or scarring from what I can see. I'm going to check your skin trigger. I'm just going to go ahead and pinch. Good. Alright. Texture is smooth, turgor at the base of the neck is good, and from what I can see, there are no lesions present on your thorax. I'm going to go ahead and just check your sides. Good. Okay. Negative for any lesions or scarring. Okay, I'm going to go ahead and have you lay down on your back with your head right up. Okay, I'm going to look across your chest for any heaves or lifts, which there are none. Good. Okay, I'm going to go ahead and palpate your sternum, Erb's point, second intercostal. Negative for pulsations, negative for thrills. It's the aorta. We're going to hop over to pulmonic, second intercostal. Negative for pulsations, negative for thrills. Erb's point. Negative for pulsations, negative for thrills. Down to tricuspid. Negative for pulsations, negative for thrills. Mitral. Positive for pulsations, negative for thrills, which is appropriate because that's the PMI, the point of maximum impulse, so you should feel a pulse. That's good. And the PMI was in the 5th intercostal space, mid-clavicular line. The rate, excuse me, I'm going to go ahead and listen quickly. And then, okay, same site. All right, Erb's point. Second intercostal. Aortic, excuse me. I'll go over to pulmonic. Good. Down to Erb's point. Good. Tricuspid. Half a step. Mitral. Good. Okay, rate was consistent with vital signs, rhythm was regular, strength was strong, all around healthy heart. Yeah. S1 and S2, there was an appropriate relationship between S1 and S2, S1 being at the apex and S2 being at the base of the heart. Negative for any extra heart sounds and no high or low pitched heart sounds. Okay. Now I'm going to go ahead and ask you to sit up for me. Here. All right. Structure is symmetrical. And there don't seem to be any deformities. Your size and shape of your thorax seems to be appropriate with your age and your height and your weight. Okay, I'm going to go ahead. Good symmetrical shoulders. Can you give me a good shrug? Shrug your shoulders. Good, strong. So shoulder strength is good. Okay, now I'm going to go ahead and palpate your clavicles and your sternum. Make sure there's no deviation. Good. Okay, I'm going to go all the way down your xiphoid process. Right there. Good. The clavicles are symmetrical and the sternum is vertical. Alright. I'm going to go ahead and have you turn your head this way. I'm going to put my hands around your rib cage and I'm going to ask you to take a nice deep breath in through your nose for me. Good. Respiratory excursion shows that she has the appropriate depth and symmetry. Okay, I'm going to go ahead and listen to your lungs. I'm going to ask you to breathe deeply in and out of your mouth, no faster than you normally would, and at your own pace. And then I'm going to have you turn your head to the side again for me. Okay. rate is consistent with vital signs, not too fast. Rhythm was regular and the depth was deep. Patient was able to take deep breaths. Effort is non-labored. There was no use of accessories and no adventitious breath sounds present. Vesicular breath sounds were heard throughout. Okay, now I'm going to assess the posterior. The structure and the symmetry seem to be good and appropriate. Appropriate to the rest of the body. I'm going to go ahead and calculate your scapulas. Good. Scapula are even and symmetrical. Okay, now I'm going to go ahead and feel your spine. Okay, I'm going to start here. All the way down to coccyx. Good. Your spine was vertical, no deviation. All the way down. Right now I'm going to check your S curvature. Good, appropriate. Curvature. Alright, now I'm going to assess your anterior and posterior transverse diameter, your spine, your armpit. Good. Anterior to posterior, where transverse is one half of the transverse diameter of the whole thorax. Now I'm going to go ahead and do your respiratory excursion again. Go ahead and give me a good deep breath. Good. Respiratory excursion is deep and symmetrical. There are negative lesions on the, except for this bug bite, on the back. Okay, now I'm going to go ahead and, now I'm going to listen to the posterior side of your lungs. I'm going to have you hug yourself tight to displace your scapula so I can listen better. And again, deep breaths through your mouth, but no quicker than normal. Good. The breath sounds are even and vesicular breath sounds heard all the way throughout. Negative for any adventitious breath sounds. The rate was consistent with vital signs. The rhythm is regular. The depth is deep. Effort was non-labored. And use of accessories is negative. Okay. Okay, now I'm going to assess your abdomen. I'm going to ask you to lay down again for me. Perfect. Okay. The abdomen appears to be non-distended. And I'm going to go ahead and listen to your bowel sounds. I'm going to pull your shirt up just a little bit. Okay. I need to time it. Hold on. Okay, there were 18 bowel sounds, which is completely normal. You can range anywhere from 5 to... Okay, now I'm going to go ahead and percuss around your stomach. See what kind of tympani. Just going to go in a circular motion. Good. Tympani heard throughout. Now I'm going to go ahead and palpate your abdomen. I just see one little scar, but nothing else. You feel. Okay, I'm going to check for your bladder. Good. Okay. Good. Did you feel any tenderness?
No.
Good. Okay, and there were no scars or lumps that I see, and did not feel any enlarged organs. Your bladder was not enlarged either. Okay, you can go ahead and sit up for me again. All right, do you have any joint pain anywhere in your body?
No.
Okay. Negative for joint pain. There are no deformities in muscles or bony structure, as I can see. Do you have any stiffness or decreased range of motion in any of your joints?
No.
No. Okay. Range of motion grossly intact. Do you notice any creaking or crunching in any of your joints?
Mm-mm.
No. Negative for crepitus. Okay. Put your hands on your legs like this. I'm going to go ahead and feel your toes. Good. Appropriate flush tone and temperature. Alright, now I'm going to assess your radial pulses again. Good. Now your posterior tibial. Good. Strong. Now your dorsalis pedis. Good. All pulses are strong and symmetrical. Now I'm going to check for your capillary refill on your fingers. Good. Brisk refill. Okay, now I'm going to check with your toes, but because you have a little bit of polish, do more on your skin. Good. Good. Toe capillary refill is brisk. Negative for any edema. Alright, now I'm going to go ahead and put my fingers like this. Can you wrap your hands around both of those? Okay, now can you push it towards me? Good, now pull it back towards you. Okay, good. Now can you push your legs towards me? Good, and back. Good. Now with your feet, can you push them up towards me? Good. All right, now, and then back. Good. All right. Upper and lower extremities are appropriately strong. Can you hop down and walk to the door? Okay. Coordination is appropriate. Do you have any difficulty with being too hot or too cold?
No.
No? Okay. Sensations are grossly intact. I'm going to have you hop back up really quick so I can check your reflexes. Okay, now I'm going to go ahead and check your brachial reflexes. Go ahead and put your arm like this. Make a fist for me. Okay. You can let go of the fist. Okay. It's fine. Sometimes you don't get any reaction, which is totally okay. Go ahead and make a fist for me. No, sorry, you can let go of your fist now. Okay, the one that really matters is the knee reflex. So I'm gonna go ahead and just good. All right. Appropriate. Good reactivity. All right. And lastly, can you tell me what my name is again?
Maddie.
Okay, good. Long-term memory is intact. All right. Thank you for letting me assess you today. And that is the end of my final return demonstration. Thank you.